welcome back. Well, it can strike suddenly and change your life forever, but there are ways to prevent a stroke. And here to tell us a little bit about that and local treatment options is Dr. Jon Zlabek from Gunderson Health System. Dr. Zlabek, thanks for joining us this morning.
Good morning.
We talk a lot about stroke. It affects a lot of people. Who's most at risk?
Yeah, there's about 800,000 people in the United States every year that have a stroke. That's about one every 40 seconds, so it's very, very common. About 2/3 are older than 65 years old, and there are clear risk factors that go with stroke. Blood pressure is the #1 risk factor. About 60% of strokes are caused by high blood pressure, and smoking is another big risk factor we see.
Okay, so besides watching those aspects, what are some ways to prevent a stroke?
So for the average person to prevent stroke, it's just really being healthy, maintaining a normal weight, eating a good diet, exercising regularly, making sure you don't smoke, and visiting your healthcare provider regularly for checkups to look for other risk factors as well.
And now the acronym that we often hear associated with stroke, I believe, is FAST. When something happens, that's kind of what you need to keep in mind. Can you explain that a little bit?
Yeah, we actually use a modification of that called BFAST, and it's an acronym. B stands for balance, so any sudden change in balance you've noticed. E stands for eye, so loss of vision in one eye or new double vision. And then the regular FAST. FAST is face, if one side of your face doesn't go up when you smile. A, it stands for arm or leg, if your arm or leg doesn't work. S stands for speech, if all of a sudden you slur your words, you can't understand another person talking. And T is really time, and that's noting the time that symptoms started and getting in right away, because for every 1 minute you wait, you lose about 2 million brain cells, believe it or not. It's really important. So call 911, don't try to drive yourself in or drive your family member in, just get in right away.
Yeah, and going with that time aspect, stroke patients at Gunderson are receiving very timely help as well. Can you tell us about how you're helping patients there?
Yes, if we get you in early, we have you come in a CAT scanner right away. We have our lab and x-ray folks ready to go. And then if you're a candidate, we have the clot buster medicine called TPA. And then we have advanced interventions beyond that if you're a candidate for that as well. So time really is important to get in right away because we can help you.
All right, Dr. Zlabek, that's all the time we have this morning. We thank you for joining us.